Hello Sparks. Thank you for visiting with me again. Why are we meeting in a hospital? Are you afraid I will kick your ass and you'll need medical attention? All joking aside, I thought you would be a great person to spread a word about the improvements my administration has made through our healthcare reform. Oh, I see. Your white coat, primetime TV shows at the White House weren't enough to dupe the public. Why would you say we are trying to dupe the public? Our reform will reduce costs and provide health insurance to millions of Americans who can't afford it. You have further cemented the elimination of market mechanisms from our healthcare system. Your reform will increase the rate of cost growth and make Americans sicker. You must be misinformed. Free markets are why our healthcare system lost control in the first place. For decades there has been nothing even remotely resembling free markets in our healthcare system. What do you mean? Where do I start? How about the restriction of the supply of medical professionals through government medical boards, the AMA, and other unions and organizations? Or how about the federal and state restrictions of insurance competition and activity, lopsided tort laws, free emergency treatment laws, HIPAA laws, and ridiculously expensive, slow, and inefficient FDA approval processes? And should I mention the inherently insolvent and unmanageable Medicare and Medicaid programs that also block markets and drive up costs? All of these laws and programs help ensure patient safety and bring healthcare to those that can't afford it. In fantasy land, that would be true and sustainable. In reality land, central planning has never been sustainable, and the evidence from our own deteriorating healthcare system adds to that fact. The government-enforced monopoly on the healthcare system blocks markets from more effectively addressing safety issues and allowing costs to fall. What makes you think markets could do the job any better? The inherent ability for businesses to go bankrupt and be replaced by more effective businesses, the natural pricing mechanism, and market competition, together most optimally ensure that costs will fall and that the best processes and services win out. These fundamental economic concepts apply to all aspects of the healthcare system, including safety and health insurance, which have become monopolistic largely because of excessive and poor government regulation. My reform enhances market competition among insurance companies. Your reform does nothing but add more central planning to the system, and that includes more bureaucratic inefficiencies, monopolistic activity, and taxation, which will lead to supply issues and innovation decay, which will lead to more cost increases, which the government will then attempt to cap, which will ultimately lead to rationing, the miserable fate of all socialist healthcare systems. Socialist countries have the highest healthcare rankings in the world. Perhaps this hospital has a surgeon that can remove Michael Moore's brain from your head. Aren't all developed countries socialist at this point? Yes. That's the first reason the highest-ranked healthcare systems are socialist. Secondly, do you not think the World Health Organization and the OECD have their own agendas? Why would you say that? Have you studied their biased ranking criteria? I have not. How about the highest-ranked systems' levels of solvency? No. Or the increasing tax burden to support them? Or the trends toward longer patient wait times? Or those systems declining areas of treatment? A closer look will show you that the top countries' models are deteriorating and unsustainable. Well, we modeled a lot of our reform off of the Massachusetts Health Plan. Yes, another brilliant central planning experiment gone wrong and close to insolvency in only 4 years.
You can't put a price on a person's health. Healthcare is a fundamental human right.
Please have her leave immediately. Hillary has a good point, Sparks. Healthcare is a human right. Yes, of course, just like everything is a human right these days. Are you not aware that there are scarce resources in the world? What do resources have to do with human rights? I see Harvard and Columbia have done you well. Labor and materials, that is, doctors, nurses, staff, medical devices, drugs, equipment, etc., are scarce resources that can only be optimally allocated through a pricing mechanism driven by the natural market forces of supply and demand. To preserve this human right, the government will allocate those resources most efficiently. The government has never done anything efficiently. Aside from extreme misallocation, when the government coercively transfers resources from some people to others, it is helping some by harming others. A human right cannot include the violation of another person's human right. People need to sacrifice for the well-being of other citizens. People can do that voluntarily, and if you would stop adding entitlements, quit removing personal responsibility from individuals, and get the government's hands off of the healthcare system, people's potential to earn money would increase, there would be more money available to donate, and healthcare costs would drop naturally, as prices always do in truly free markets. That is very insensitive of you, Sparks. No, it is very insensitive of you that you are piling mountains of dirt onto the face of our gasping healthcare system. Why would you say that? Your expansion of Medicaid and new coverage requirements will perpetuate more medical system abuse and drain more money from the already insolvent system. Besides that, your taxes on devices and drugs will stifle innovation. Other than that, your health information system enhancements will add endless bureaucracy and drive adoption at many times the actual cost. Aside from that, I could continue, but do you not already realize what you have done to yourself? I don't understand. One day, when all the stresses from the problems you've added to the country catch up with you, you'll have to seek medical treatment and you'll surely find the best hospital in the country to visit, where you will wait in a line for many months behind scores of other people, to see the single doctor still willing to work there. And once you're finally treated, you'll realize that you're completely screwed, as that one doctor will have no innovative equipment, devices, techniques, or drugs to use on you. In addition to this deteriorated level of care, the only other big difference between you and the guy over there will be that you will have made your own bed,